Hey guys, this is Nicholas here at the Center of Dental Professionals. I'd like to take some moment to talk to you about this really important thing. It's called a crash cart. It's really important because it has all your emergency medication you need. It has your emergency instruments used to save a life, and also it has emergency procedures on what to do. This is really important to have in every office just because it contains all the safety and emergency materials just in case anything happens to a patient. It will really help you save somebody's life. You never know when that's going to happen. Nobody expects anything horribly to go wrong at the dentist, so you want to do everything you can to take care of the patients. I highly recommend when you go into your office, you talk to your practice administrator, your doctor, or anybody in charge of the office on where you keep the crash cart, what instruments goes in there, and what they prefer for it, and also who they want to track the medication in it. Like I said, you never know when any emergency material will happen, and you really want to make sure you know everything about your crash cart. All right, guys, here's an example of how our medicine cabinet in our crash cart looks like. You want to have some of these medicine. You don't have to have everything. Again, it's based on the office and the doctor's preference. So some of the major medicine you need is aspirin, nitroglycerin, your epinephrine, and also your albuterol. We have a lot of different medications in here. That's what we have for our office. We tend to do a lot of other stuff like oral surgery, or we have OR where we put kids to sleep, so we have more anesthetic. Again, it's based on what office you work at and what your doctor prefers. Next, we'll have the different syringes. We have a 5cc, 10cc, at 20cc. We also have some masks. And also we have the catheters in here, and then we also have some needles and also some alcohols to wipe the hands before you do anything. And then in here, this is one of my favorite stuff. This is the airway opener. We have a couple of different sizes. This is for kids, the little green one, and the white ones are for teenagers and adults. We also have some for little small kids. So the way this works is you place it in the mouth like this. So pretend your patient is facing you this way, and then you'll place this in there. Use it to pull the tongue back. That way you can see through it. We also have some IV lines. Next row. Whenever you hear of the phrase bag 'em, this is what this means. So in here, you have a little oxygen portal that goes in here. So what you do is place it on there, place this over the patient's nose, and then slowly pump some air into them. Okay, and then you also have your the blood pressure cuffs. This is really important. You should have one in the office at all times. If you have any patients, not even for emergency, like an older patient that has heart problems, before you work on them, you want to make sure you take their blood pressure before you do anything. Just because if you give a patient certain anesthetic, it can raise their blood pressure. You also have a stethoscopes. This material, this is what we are looking up earlier. So this you can also place in the patient's mouth, same way. And then once you place it in there, I don't want to open this. It gives you the instructions on how to do them. So if you can see really clearly, it goes by step instructions. Usually the doctors will place this in there, but you just want to have something like this in your crash cart for your patient. And it comes with a lubricant so it can go down the throat really easily. This is our defibrillator. You should also have one in your office. If you don't, ask your practice administrator about it. So in here, once you open it, we already had this opened up, just in case it's not fully open, but in case of an emergency, we'll have to take everything out. You should have one. And then once you open it, it kind of goes over the instructions on where to place them, how to test it, and also check and see if your patient is responsive or not. The other material that we have is a portable oxygen tank. Now, in case of an emergency, you just grab the oxygen tank. It usually comes with a couple of hoses. I'm going to open this one. Attach the hose right here. Make sure it's fully fastened. And then you want to open up the oxygen. As you can see right now, it's going in. So you would take this, cover it over the patient's face, and then have the patient breathe through here. Good. Again, once you go into your office, ask your provider or your practice administrator where your crash cart is. And then please, I hope you don't have to use this, but if you do, I hope you're well prepared, and also talk to your doctors and all your assistants so they know how to properly handle any emergencies that might arise.